Welcome to Empowerment Nursing's application on In the Know, and this week we're going to be applying the Glasgow Coma Scale, often referred to as the GCS, which is the number one level of consciousness indicator in our patients. So the question is as follows. The nurse is assessing the level of consciousness in an unresponsive patient with a head injury who has come into the emergency department. Using the Glasgow Coma Scale, the nurse assesses that the patient responds with sounds that are not understandable, opens their eyes only as a response to pain, and has abnormal extension of the extremities. What should the nurse do? So in order to come to the correct answer in terms of this question, in terms of what should the nurse do, you have to first be able to score that patient given the scenario in the question. So if you didn't tune in to our Facebook Live earlier on this week, we're just going to refer to that table now that helps you simplify down that memorization. So as you can see here, we have the Glasgow Coma Scale. The Glasgow Coma Scale, eye response, verbal response, and motor response. 4 possible points in the eye response, 5 possible points for the verbal response, and 6 possible points for the motor response of the patient. We're going to take the stem of our question and apply it so we can get a score on our patient. The very first thing it says is that the patient is making sounds that are not understandable. So if we look at our verbal response, we're looking right here at sounds, right? So the patient would be scoring a 2 for verbal response. Then we have that they only open their eyes as a response to pain. So if we look at the eye response, then we're scoring a 2 here. So we have a total of 4 thus far. And the very last part we have is abnormal extension of the extremities. You can see here that abnormal extension is also worth 2 points. So we have a total of 2 plus 2 plus 2, which would give us a Glasgow Coma Scale score of 6. Now, also, if you turned into that Facebook Live, you would know that we're not really concerned about a score from 3 to 15. We are watching kind of scores between 9 and 12, worried and watching, we like to say. And anything less than 8, we would intubate. So before I even read the possible answers to this question, I can predict what I am going to do as a nurse based on a Glasgow Coma score of 6. And this is how content makes the questions easy. So now let's look at our possible answers. 1, reposition the patient into normal body alignment. 2, notify the physician. 3, attempt to waken the patient. Or 4, prepare the patient for intubation. If you can draw out that Glasgow Coma Scale and you know that principle, less than 8 we intubate, then you'll have absolutely no doubt that the right answer to this question is indeed number 4. We would be preparing that patient for intubation. So for the answer to this question and even more, you can check out our complete study package. Bye for now.